Every day, 130,000 people around the world suffer from a wrist, hand, or forearm fracture. Arm fractures cost the NHS over £520 million every year. Those of you who have experienced it know it hurts and can take months to recover. Let me tell you a story. Susan fell off an electric scooter and broke both of her wrists, requiring surgery that was long and difficult due to the high number of broken bone fragments. The surgery involved metal wires and plates being screwed into her. She thinks the worst is behind her, but weeks later, she's been called back in for repeat surgery due to a refracture. She has to go through the surgical process all over again. Now imagine a scenario where the patient doesn't have to use metal plates and wires. Imagine a device that ensures the patient doesn't have refractures, and imagine the surgical process being simplified for the surgeon, no matter how complex the fracture is. This is why, at Imperial, we have developed a bone adhesive that's been vetted by clinicians. The product is less invasive, biocompatible, and enhances the natural regeneration process, allowing for quicker recovery. And the best bit, it's injectable, meaning it can be applied to bone as easily as glue is applied to paper. After the adhesive sets, it holds the fragments of bone in place, allowing the bone to heal. And so far, benchtop studies are showing great results. We are planning to obtain a UKCA mark to launch in the UK through the NHS, and to do this, we are asking for £3.5 million to conduct further benchtop studies and complete clinical trials. My name is Remy, and together, we will revolutionise surgery and bring fracture patients back to their lives using our bone adhesive. Thank you for listening.
Well, thank you very much, Remy. Again, the same format. 2 questions from the 2 panelists, starting perhaps with Michelle to start.
Thank you. Very interesting. I was wondering if you can go into detail about the benchtop studies that you've done and that they're showing great results. What do you mean by that, and what's the next step as well?
So currently in the lab, we've conducted adhesive tests, biocompatibility tests, and mechanical property tests of the polymer. And we found out that it has desirable mechanical properties that match the bone. And it also cures, which means to harden very quickly.
Okay. So this was obviously all in vitro, like in the lab you mentioned, right? Am I here? Okay. All right. And in terms of biocompatibility, can you go into detail with that? So you test it on specific cell lines or specific cell, is it any details on that? Yeah.
Yep. So we've tested the adhesive in vitro, and we found that it supports the adhesion of stem cells, specifically mesenchymal stem cells, which support the bone's regrowth.
Okay, thank you.
Hello, hopefully people can hear me a bit better now. Right.
Yeah.
Okay. Couple of quick financial questions. So £3.5 million to clinical studies. Where have you got this number from?
So this number has been obtained from a direct competitor who has recently finished their clinical studies in the US, and they have raised £3.5 million. This is where we've got on.
Sounds like a bargain, actually. And if we look 5 years down the line, who would you be looking to exit to, assuming you're not going to build a huge multinational generation?
And we believe we have first mover advantage, and so our end goal is to be acquired by some of the big medical technology companies.
Okay. Any examples? Or
such as Johnson & Johnson.
Okay.